If you have a newborn, you should know about jaundice, which is the yellowish discoloration of the skin commonly seen in babies. It is caused by the buildup of a chemical known as bilirubin in your baby's bloodstream. It is commonly seen in infants born less than 38 weeks of age, in some breastfed babies, or in some cases, it is caused by an underlying disease. Jaundice occurs because the baby's liver is not mature enough to get rid of the excess bilirubin. And in rare cases, when there is very high levels of bilirubin, it can put the baby at risk for brain damage. In this video, we will talk about all the important things you need to know about jaundice in newborns. How common is it? How about breastfeeding? And what are the other risk factors? When is bilirubin checked? When should you worry? When to call the doctor? And how is it treated? Hey, I'm Dr. Kristine Alba Kiat. I'm a board-certified pediatrician, and my mission is to help moms and dads deal with child health problems to raise happy and healthy kids. Jaundice in babies. So how can you tell if your baby has jaundice? Well, the skin appears yellow. It is best seen under white light, like in daylight or under fluorescent light. What usually happens is that jaundice first appears on the face and then goes to the chest and then the abdomen and then the legs as the levels of the bilirubin increases. It is also seen on the whites of the eyes that appear yellow. In darker skinned individuals, it is much harder to check though. So what are the symptoms of a baby with jaundice? There's yellowish discoloration of the skin and the whites of the eyes. It usually appears by the 2nd to 4th day from baby's birth. Now, let's talk about some of the common questions you might have. How common is jaundice in babies? Well, the blood contains bilirubin, which is from the red blood cells, and this is removed by the liver. Before birth, the process is done by the mother's liver, and after birth, it takes a while for baby's liver to get better at removing bilirubin. Can jaundice hurt your baby? Well, in some mild cases of jaundice, it is but a harmless condition. But in rare cases when the bilirubin gets very high, it can cause the condition known as kernicterus, which can lead to brain damage. Which is why it is important to check for baby's bilirubin levels. Another common question, does breastfeeding affect jaundice? Well, jaundice is more commonly seen in breastfed babies compared to formula-fed babies. It may be due to difficulty nursing or getting enough milk, or other contributing factors might be from dehydration or low caloric intake. But despite that, breast milk is the best for your baby, which is why experts recommend breastfeeding. It is just important that baby gets enough milk. What happens is that in the first 24 hours, each feeding, baby would get about 1 to 2 teaspoons of breast milk. But what we can do is to aim for 8 to 12 feedings per day. And also, the amount of breast milk that baby gets increases per day. This would help keep the bilirubin levels low. What are the other risk factors for jaundice? Another risk factor is prematurity. For babies born less than 38 weeks of gestation, they might have a more difficult time processing bilirubin as compared to full-term babies. And also, preterm babies may have less bowel movements a day, which would lead to less bilirubin eliminated per day. Another risk factor is significant bruising at birth, which may happen during delivery, and this would lead to increased bilirubin levels from the breakdown of the red blood cells. The third risk factor is the blood type. If the baby has a different blood type from the mother, and the baby might have received antibodies through the placenta, and this would lead to the rapid breakdown of the red blood cells, leading to increased bilirubin. And the last risk factor is the race. It has been shown that East Asians have increased risk of developing jaundice. So, when should the bilirubin levels be checked? And when to worry, when to bring to the doctor, and how to go about follow-up, and how is jaundice treated? Well, before we go to that, do you have a newborn baby? Or you're expecting a baby? How much better life can be when things are under your control upon baby's arrival, where you feel confident and know how to go about breastfeeding your baby, when you know how to soothe a crying, fuzzy baby, when you know when to worry and call the doctor, when you know about postpartum depression and know how to deal with it, when you understand your baby's sleep schedule better. How much better life can be when you can get the training in the comfort of your own home. Well, I've developed an online training video series known as the 5 Newborn Care Strategies. Do check that out in the description section. So when should baby's bilirubin be checked? Well, if baby develops jaundice in the first 24 hours after birth, then baby needs to have a bilirubin level checked right away. And all babies need at least one bilirubin level checked either through the skin or a blood test before discharge. As to any additional bilirubin levels that need to be checked, well, it would depend on your baby's age, the level of the first bilirubin, or if there are other risk factors that would put your baby at increased risk for jaundice. And take note on follow-up, for babies who are discharged before 48 hours of life, they need to be seen by the doctor sooner, by about 2 days from discharge. So when to see the doctor? Well, the American Academy of Pediatrics recommends that all newborns be checked for jaundice during each routine checkup. And for babies should be followed up by the doctor and examined for jaundice between the 3rd to 7th day of life. This is because this is the time when the bilirubin levels peak. And also, for babies who are discharged less than 72 hours of life, these babies need to follow up with their doctor within 2 days from discharge. Then, when should you worry that your baby might be suffering from severe jaundice or complications from excess bilirubin? Well, when your baby's skin appears more yellow, when the skin on the belly, arms, legs appear yellow, when the whites of the eyes appear yellow as well, when baby is acting sick or difficult to awaken, when baby is not gaining enough weight or feeding poorly, or if baby has a high-pitched cry, or baby appears fuzzy or difficult to awaken. Then, how to go about follow-up? Well, some babies may need earlier follow-up because they are at increased risk for jaundice. Ask your doctor if your baby needs early follow-up, if your baby has increased bilirubin levels at the hospital, if your baby is born early, like 2 weeks before the due date, if your baby developed jaundice in the first 24 hours of life, if your breastfeeding is not going well, or if your baby has a lot of bruising or there is bleeding under the scalp, or if your baby's siblings, brother or sister, has history of increased bilirubin levels, or if a brother or sister needed light therapy. How is jaundice treated? Well, in more common cases where the jaundice is just mild, no treatment is necessary. But if your doctor deems that your baby needs treatment, your baby would be undressed and placed under phototherapy, which is a special light that would help decrease the bilirubin levels immediately. Your baby may need to be admitted at the hospital for that. In some babies, breastfeeding is supplemented with formula for a while. In some rare cases, when there is very high levels of bilirubin, this becomes a medical emergency and your baby may need to be brought to the intensive care unit and may need a special type of blood transfusion to lower the bilirubin levels immediately. So when will jaundice go away? Well, in breastfeeding babies, it is common to have jaundice last for a month or maybe longer. While in formula-fed babies, they can have jaundice for about 2 weeks. Let your doctor know if your baby is exclusively breastfed and has jaundice after more than a month, or if your baby is formula-fed and has jaundice for more than 2 weeks. Hey, if you like this video, watch my next video where I teach you about other child health problems.